Hello everybody. I want to demonstrate to you the use of a new setup that we're using at Surya Plastic Surgery. This is a new machine called a ProNox machine for the office, but it's not new to the market. Essentially, this is a system to give some comfort to the patients who are undergoing procedures. So this patient here is a dear patient of ours, Catherine. She's known us and we've known her for a couple of years now or more, and we've been doing some small things for the face, injections, lasers, etc. And so the injections always cause some anxiety and obviously some pain. We do the usual stuff to put some numbing cream on the face and things like that, but still, and occasionally also give some oral medications if there's higher anxiety, but still it's not 100% pain-free. So one other layer of comfort we're adding today, and want to demonstrate to you how this system works. This is called ProNox, and this system has two gases essentially, oxygen and nitrous. They are mixed together and delivered. Where's the tubing? Yep. So we're going to set it up to show you guys. So this is essentially a self-regulated, comfort tool to give nitrous and oxygen to patients, and we're just hooking this up to this machine. And it has a mouthpiece, as you can see. I'll share with you here. It's hooked up. There you go. All right, so it's this simple, okay? So essentially, it's almost like a one mouthpiece like this, and the patient actually holds on to it, like so. We're not started yet, but just to show you. And she's going to hold it herself and put this in the mouth to create a seal. And she's going to breathe in, and she's going to regulate her own dosing of this gas essentially. And when she feels some effect of relaxation or what we call disassociation from pain, she's going to take it off, and we're going to continue on. And when she needs it, she can just use it as she needs it, and we're going to communicate verbally as we go. So you haven't taken any oral medications today, correct, Catherine?
No.
And only thing you've done is just put some numbing cream on so far. Okay, so this is the setup. I'm going to save this here for a second, and then we're going to turn on the system. Is it already on?
Tanks are already on, so all we have to
let's
do
turn it on.
is switch it on to the on.
Will I inhale?
Yes.
But
Why
I
don't
can
you-
breathe through my nose and my mouth. I
So-
mean, inhale.
You're gonna only inhale through your mouth,
Okay.
not through your nose, and if that's difficult, we have a little nose
Yeah.
clip right here.
So it's really important that you seal this comfortably around the mouth and try to inhale through the mouth only, because this is where the gas is going. And this is the tubing where the nitrous is going to go away, so nobody around the room gets any effects from it. And so here you go. I'm going to give this to you.
Now
So put it in your mouth and seal it.
up to here. Wait,
Just-
up to that.
Yeah.
Whatever makes you feel comfortable. Whatever's more comfortable to you.
Yep. And then start breathing through your mouth only, not your nose.
So
And
that's
go ahead
my
and put
breath.
your head back and relax, and just try to be in a relaxed state of mind. Okay, so in about 3 to 5 minutes, she's going to start feeling the effects of this, and that's about the time when we're going to get started. So, all right, I'm going to get started. All right, don't suddenly jerk or move. So she's breathing, and I'm doing my injection. So she's relaxed, I'm relaxed, and hopefully she's not feeling too much pain. How are you feeling? You feel okay?
Feel good?
I feel it.
Good.
I can feel the vibration of the gas going through with my hand here as I touched it, so I know it's working, and I know she's inhaling it. The goal with this is not like an analgesic, right? The nitrous is not really an analgesic like Vicodin or some kind of narcotic. This is really a dissociative type of gas that essentially means that the patients may feel discomfort, but they don't associate that with pain necessarily, and they generally don't care about it. So that's the general outcome that we're going for. So I don't want to confuse this with the analgesic, okay? So this is something that they may report that they're relaxed, they're doing fine, and the experience is comfortable for them, but we're not completely eliminating pain. It's a dissociative kind of feeling. So do you feel anxious? Do you
No.
feel...
Oh, I feel real good.
Okay.
Yeah.
So this is the second phase, right? I injected the Dysport or the Botox already. Now I'm doing the eyes. So as you can see, she's still monitoring her own inhalation of the nitrous, and I'm doing the injections of the lower lids. And she seems relaxed. She's not moving. She's not flinching. And she should have two effects from this, short-term acute effects from this. One is that she has disassociation from feeling of pain, meaning not caring about it, although she may feel the prick of the injection. The second thing is towards the end of the procedure, she should have a memory loss of what actually happened, which is a typical thing people describe. And as you can see, she's cooperating with me. She's moving her tubing as I'm doing it, and I'm injecting some filler called RHA to her lower lids. So the goal by introduction of this ProNox system into the practice is to do laser procedures, to do microneedling procedures, to do fillers, to do surgery in many cases under local anesthesia, so that the most uncomfortable part of that is really the injection, which is what hurts. So once that is in place, then the surgery generally goes well. Was that okay? Good. You feeling good?
No pain.
Great. So Catherine, take that out of the mouth for a second. So how was the injection? Was there any pain or no?
None at all. None.
Okay.
Super. Very good.
So is this experience different than before when you had the injection so far?
I like it when there's no pain, and there was no pain.
Awesome.
Very, very good.
Awesome.
Nothing to do with you. You're perfect.
So 2022, we're going to try to make it a beautiful but pain-free experience here at Surya Plastic Surgery. So if you guys want to do some injections, some fillers, some lasers, some microneedling, surgery under local anesthesia, which can include facelifts, which can include some liposuction, which can include anything really, J-plasma or thermi, any of these procedures that we do. We can do all of this very comfortably under some oral medication, some local anesthetic with the nitrous ProNox, which is a very, very good way to avoid deep anesthesia. And it's going to make everything more affordable. Obviously, you're going to be in more control and pain-free essentially, but without any limitations of doing exactly what we want to do in surgical terms and procedure terms. Okay, come check this out at Surya.